I'm Sean Griffin, and I'm the Head of Communications and Public Affairs at the Pandemic Ethics Accelerator, where I've worked since the beginning of March. And since last May, I've been in my other role working for the British Medical Journal, attending lots of press conferences with national media about COVID, and I've written about 50 articles for them since last May on COVID and related issues. I'm going to take you through some of the media highlights, really, how the media has covered some of the issues around COVID since the beginning and up until quite recently. It started really with this reports of mystery virus in the Wuhan area of China, and that began to spread across the world. The Chinese authorities said that they were investigating 27 cases, but were unable to confirm the cause. And then in January 2020, 2 patients in England were confirmed to have tested positive for that new coronavirus, and it was beginning to spread across the world. And I think it kind of was brought home to people in Europe. There was the cases in Italy after the skiing holidays and so on, and the stories of the footage of people singing from the balconies in Italy where they were locked down and unable to go out. And then in March, the World Health Organization declared COVID a pandemic, and at that point there were concerns about the government messaging as the UK was holding off taking measures to restrict movements and so on that other countries were doing themselves. And so amidst fear that the NHS was being overwhelmed, Boris Johnson advised people to stay indoors and avoid unnecessarily contact. And that became law around the end of March, alongside that stay at home and protect the NHS message. So there was a lot of fear and uncertainty around the virus, and there were a lot of reports in the media and explanations about how it works, talk about the spike protein and how it attaches to cells to infect them, how it spreads, whether that's through surfaces and coughs and sneezes and so on, and of course its origins, where did it start? And then later in the month, the government announced lockdown of all schools, or the closure of all schools, and then the first lockdown measures were introduced in March, but they were different. Each of the different UK nations were taking different approaches to the lockdown, like the 2-metre rule, the face coverings, and travel restrictions and so on. And then later in March, Matt Hancock promised 100,000 coronavirus tests would be carried out by the end of the month. And then a bit later on, around May and June, there were reports that the UK had surpassed Italy to become the country with the highest death toll in Europe from COVID, with 32,000 people sadly dying with COVID. So Boris Johnson announced a plan to lift restrictions, and people were allowed out for unlimited exercise, you remember, to meet one other person if it's 2 meters away. And quarantine measures were announced, requiring people to self-isolate for 14 days to help slow the spread of the virus. And as the NHS was overwhelmed, there was an anti-inflammatory drug which was used for other purposes called dexamethasone, and that was approved after it was shown to help people and reduce the amount of time of hospitalisation of people with COVID. And then also around this same time, the Test and Trace, which is called Test and Protect in Scotland and Test, Trace and Protect in Wales, was introduced. And with some controversy, many people weren't being reached by the methods, or didn't or couldn't isolate for various reasons, including financial reasons as well. So patients were being moved from hospitals to care homes without testing, and into those care homes that didn't have adequate PPE or personal protective equipment. And that led to a large number of deaths in care homes and a huge amount of concern amongst the public and amongst the media. And then, of course, the government was in crisis at the end of May after that huge media and backlash as a result of Dominic Cummings visiting the Castle Bernard in the north of England and breaching lockdown measures. So over the summer, the lockdown measures were relaxed, and again, they varied across the UK, and initiatives to increase spending and support businesses were introduced, like the Eat Out to Help Out scheme in England. And in the summer also, the NHS predicted that the delays to cancer diagnosis and treatment could cause thousands of excess deaths in the UK within a year. And over the summer, the UK recorded the highest number of daily new coronavirus deaths since June, after these lockdown measures were released. And then there was talk of the vaccine starting around the summer, and which was obviously one of the UK success stories. And so UK government ordered 100 million doses of AstraZeneca vaccine, as well as a number of other vaccine types. And Matt Hancock started the talk of the vaccination programme starting by Christmas. So in the autumn, children started to return to school and cases rose. The R value, which is this measure of the virus's ability to spread, rose above 1 in the UK for the first time in early March. And around that time, social gatherings of more than 6 people were made illegal in England. And obviously there were similar approaches in Scotland and Wales and Northern Ireland too. Lateral flow tests were introduced with some controversy, I have to say, in September. And more than 1 million people downloaded this new app, this contact tracing app, in England and Wales in just one day. So coming on to November, the vaccine trials all over the world and in the UK as well started to show some promising results. And there was a report by the National Audit Office which reported a lack of transparency and inadequate documentation of some of the key decisions around the purchase of this PPE and other contracts that the government was letting. And then in December, there was a 3-tier COVID system that was introduced in England, with areas separated based on infection rates and different lockdown restrictions came into force across the UK in different countries. And then it happened. The first vaccinations of the over 80s and people who are clinically vulnerable, they were reported and took place just before Christmas. And then there was a lot of explanation in the media about how the vaccines work and the different types of vaccines. Then, of course, around December, there was the pre-Christmas lockdown, and so that planned relaxation was scrapped or cut over Christmas in the different nations, and in England, different Tier 4 measures were introduced to southern England to try to control the spread of one of the new variants. And then coming up to March this year, it was the 1-year anniversary of COVID being sadly recorded 125,000 COVID deaths and 4.2 million infections at that point. At this time, the vaccine effort was being ramped up in the UK, and then there were rumours of some very rare side effects that were happening from some vaccines, the AstraZeneca one in particular, and they started to emerge in the media. And as a result, some of those EU countries had concerns about using the jab there. And at the same time, East Asian countries were opening up again after successfully managing the virus because of, I think, cultural and other approaches and the previous experience of managing SARS and other respiratory illness. And of course, another theme throughout this pandemic is how much the government should have a say, and it should be legal requirements versus people taking personal responsibility. And so, and recently there's been images of talk of people taking responsibilities around mask wearing and keeping distance and so on. But that's been kind of put alongside images of people out watching the football and rising cases, particularly amongst men, following those mass gatherings. So I think it's the impact of those things is and that discussion is bound to continue.